I'd like to welcome to the stage Dr. Kimmy Sue, Senior Movement Disorder Fellow at VA, Puget Sound, and the University of Washington. Dr. Sue, join us on stage, and she will also be joined by 3 clinical coordinators and research participants who will introduce themselves for this panel. Thank you so much. You need to hold it quite close.
I hear. Good morning, everyone. Thank you so much for coming to the symposium. It's a beautiful day outside, so that means a lot, especially in the Seattle world. And thank you, APDA, for hosting such a wonderful event. So this is a unique part of the symposium. This is your first-hand chance to ask research coordinators in the local area, as well as 3 patients who have gone through research studies, ask them the questions about how it's been going through a research trial. And some of them actually have been through several research trials, so they have a lot of experience. So ask questions. We're going to make this nice and laid back. Any question you have, feel free to raise your hand. And we have people with microphones who will be running around getting the microphone to you so you can ask your questions. And can you hear me in the back? I know the microphone is a little bit soft. So are we good in the back? Great. Excellent. So I feel very far away from you all. Let me get closer if I can. Okay. 1 second. Okay, so we have a wonderful panel of 3 research coordinators. I'll list their names and then they will introduce themselves. And then again, 3 wonderful patients. So the 3 clinical coordinators are Krista Spector, who is from the VA Puget Sound, Melissa Bixby from Inland Northwest Research in Spokane, Washington, and then Dr. Sudeshna Ray at Evergreen. So I'll have first Dr. Sudeshna Ray, since she's nearby. Oh, I see. We only have the microphone up here. I guess, can we pass it around? Perfect. The trick will be to, oh, there we go.
So, hi, good morning, everyone. I am Sudeshna Ray, and I am the Clinical Research Coordinator at the Evergreen Health Hospital. It's called the Booth Gardner Parkinson's Care Center. So we intend to give comprehensive care to our patients. So we have neurology, neuropsych, social workers, neurosurgery, and rehabilitative services all under the same roof. As for the Department of Research, we have various clinical trials for patients with early diagnosed Parkinson's, patients in their mid-stage, and also for the patients who have been there with Parkinson's for quite some time now. We address both their motor symptoms and the non-motor, the non-movement symptoms, that is. And I'll be happy to talk about it as we go along in the session today. And I will briefly introduce you to Deborah Sanders, who is one of our clinic patients who participated in the GOCOVRI trial, the pivotal trial, which led to the FDA approval of the drug, and then finally it was approved in 2017. Deborah is multifaceted, and she is also an artist, I believe. Thank you, Deborah, for coming in. We appreciate it, really. And thank you, Jennifer, for inviting us over, because it's been such a pleasure and honor to be in front of such diverse crowds. So thank you, guys. I'll move the mic over to the next person. Deborah.
Hi. Oh, no, you are okay. Hi. Hi, everybody. How many of you have Parkinson's disease? Okay. Bunch of us. Yeah, aren't we special? How many of you are caregivers of Parkinson's? Yeah, be nice to the caregivers, because they are the ones that count. Anyway, I started with the Booth Gardner Parkinson's Clinic, and I was very honored to have my brilliant Dr. Pinky Agarwal as my doctor. She always knows the right answers for everything. But I've been diagnosed for 16 years with Parkinson's, and it was slow at first, but things got a little more progressed after a while. And my Parkinson, my neurologist, there you go. He thought I should go to see the Booth Gardner Parkinson's clinic because they were up on the latest things, and it was the smartest thing I ever did. So going there, I was introduced to the Parkinson's study groups, and I had dyskinesia really bad after a few years, maybe about 8-9 years in. It got really bad, and it's very upsetting to your system to have that dyskinesia. So I was more than happy to jump into that trial, and I have a little bit now because when I'm not in the social setting, it kind of crops in. But I was in the GoCovery trial, 2 of them, back to back, and it was a hard year after they stopped the trial where I couldn't take my GoCovery any longer. And very happy to be back on it in January of this year. But it's really worth your while to get in there and be a participant because it helps your self-esteem, knowing that you're doing something to help other people. And if I could get one person on GoCovery, that would be major for me. Here I am, and I am an artist, and I have continued to do my artwork. I was on hold for a while because it's real hard to paint when you're all over the place, unless you want to do abstract. And I also make jewelry. Yes, I make jewelry with little tiny things. I wasn't going to give that up. And I like to play pool. My husband and I started playing pool, and we play like 3 or 4 nights a week. And sometimes I take my wheelchair, sometimes I take my walker. Sometimes I don't even need any help at all. I have in a wheelchair today because I had back surgery 3 weeks ago, and that went well. So happy about that. But most of the time I'm walking, but my husband, he kind of hovers. He's a hover. But you got to be careful and treat your caregivers well because they are really the best thing for you. So, and I just want to say I'm thankful for GoCovery and for the clinic. And well, you can ask me questions if you want. I'm not shy.
Great, thank you so much. So next I have Melissa Bixby from Inland Northwest Research.
Hi, I'm Melissa Bixby. I'm here from Inland Northwest Research. I work in site in Spokane, Washington with Dr. Jason Aldred. If you guys don't know him, he's right there. Yeah. So I'm here with Bob, one of our participants in our Biogen monoclonal antibody trial. He was with us for some time in our phase 1 and phase 2, so I'm going to introduce you to him in a second. I could tell you a lot about myself, but I love being a coordinator, but really what I'd love for you guys to take from this panel is ask questions that are going to make you more comfortable with research. You're not a guinea pig. It's a very personal thing. Bob, we get to know our subjects like family. So we want you all to be comfortable, and we want you to see this personal side of this. So I'd be happy to answer any of your questions. And to let you know, also Spokane isn't just some podunk town on the other side of the state. We do have patients that come from all over, from Portland, from Seattle, from Canada, Alaska. So it's a really wonderful site I work at, and I'd love to get a chance to talk to you all about it. So I'm going to introduce you to Bob.
Thank you. My name is Bob, and I have been diagnosed with Parkinson's about 2.5 years ago. And shortly after I was diagnosed, my daughter had come up from Portland and was spending the weekend with us in Walla Walla. And in the course of our conversation, I was standing in front of her. She was sitting down on a chair, and as I was standing there, my left hand started doing its Parkinson's thing. And she watched it for a moment and then all of a sudden just burst out, "Stop it! Stop it!" And, you know, don't we all wish that we could simply say, "Stop it," and it would stop? But we're not miracle workers. There's no magic bullet right now. But the reason the three participants and myself, the three of us here, are doing this is because we want a cure for Parkinson's. Anything that we can do to help bring about a cure makes our time worthwhile. When I first went to Dr. Aldred to be diagnosed, one of the questions we asked in our time to discuss options was, are there any studies going on that I can be a part of? And there were 3 studies going on that he mentioned at that point. And of those 3, we chose the Biogen study. And that was the best decision that I've made as far as the Parkinson's is concerned. At this point, I can say that I haven't noticed any changes in the 2.5 years. I know with Parkinson's, that's maybe not anything significant because things change and develop over time. But for me, it's still good news. And anything that we can do to bring a cure someday for this disease is going to make this the best thing that we can participate. We're a team. We work together as participants, as coordinators, as researchers. There will come a time when we can stop the progression, we can bring a cure, and that'll make it worthwhile for anything that we've gone through. So I'm looking forward to hearing more of what's happening in the science of Parkinson's, and glad to be able to be here.
Thank you, Bob. Great inspirational words. So lastly, I have Krista from the VA, and I'll have her introduce her patient as well.
Hi, I am Krista Specketer, and I work at the VA in the University of Washington in Seattle. I've been coordinating Parkinson's research studies, clinical, genetic, biomarker studies for the last 3.5 years. Working with the Fox Foundation. I also help with the Washington State Parkinson's Disease Registry, which the APDA sponsors, and we have a booth today if you're interested. And I don't also want to talk too much about myself. What I want to emphasize here is, again, that research participation is not this impersonal thing. We care a lot about our participants. We do see them like family. We learn about their families, what's going on in their lives. We try to stay really involved, and we care about every step of their disease process in their lives. And there are lots of different ways to get involved. We do a lot of clinical studies, so studies that don't involve interventions if you're not interested in drug trials. There are also ways to get involved that are over through the mail or on the internet if you're limited in mobility or can't get to Seattle. And we want to make all of those studies as accessible to you as possible and give you lots of opportunities. And also destigmatize some of the things that are scarier, like lumbar punctures or DAT scans. So we're happy to answer any questions today. But otherwise, I would like to introduce Skip Satterwhite. I've been working with him for the past 3.5 years, and I'm going to let him introduce himself and talk about his participation in our research studies.
Thanks, Krista, and thanks for the opportunity to talk to you. When my wife and I learned I had Parkinson's 7 years ago, we immersed ourselves in as much information as we could. And we heard about Michael J. Fox and his foundation. And although he was a celebrity I wasn't familiar with, his foundation seemed very well endowed and seemed to have great sense of purpose. I became listed in the Parkinson's Disease Registry, which soon notified me of Fox's Parkinson's Progressive Markers Initiative, or what is called PPMI. And they were looking for candidates who were diagnosed with PD and preferably not on medication, as well as for a cohort of healthy candidates. The study didn't include therapeutic trials. They weren't interested in products that could be ingested or used therapeutically. They were interested in information that appealed to me. I wondered to myself, what marked a person as one who would develop the disease? How can you tell if someone is going to develop Parkinson's? And then how can you confirm that they have it? So it appealed to me also as a way of confirming my illness and explaining my severe anxiety and depression, which are non-motor symptoms. So the first thing I was given as part of the program was a DAT scan, which would help to confirm the diagnosis, and which incidentally was not covered by my health care insurance. So happily I tested positive so I could be in the program. Having enrolled in PPMI, I was notified of other studies which piggybacked on PPMI, among them the Alzheimer's Foundation, PANUC, and Outdoors for All tandem biking program, which I attended. So by signing up with PPMI, or the Michael J. Fox Foundation's program, the bells went off to a lot of other programs. You'll find if you sign up for one program, you'll start getting mail from all other interested researchers. So what did it consist of? PPMI was administered mostly at the Harborview VA hospital, at the VA hospital. And over a period of 5 years so far, I've taken a battery of blood tests, MRIs, Parkinson's UPDRS exams, 3 spinal taps, and cognitive tests, so they can see my progress or diminution. So this data is held in data banks at selected universities and is available to any interested researcher. I wasn't informed of the results, but in case something goes wrong, they're obligated to tell me. I have to say I've felt very pampered by the administrators, such as Krista. PPMI, I'm treated like a king when I go down there for my routine tests. And it makes it very challenging for them because their protocols are constantly having to be changed and they're having to adapt all the time. Incidentally, once a year they have a luncheon, which is sponsored by Michael J. Fox, which I'm very appreciative of, in addition to my reimbursement for parking fees.
Well, thank you all for your introductions, and special thanks to Bob, Skip, and Deborah for your discussion of your experiences with research. So now I'll open it up to the audience for questions. I'm sure you have a burning question you want to ask them. So we have microphones, and anyone who has a question, raise your hand. I think we have a hand right here in the back. Yes.
Okay. Most of these trials have age limitations. Do you know any trials that are that accept people over 85?
The question is there age limitations to the studies? Are any studies available for above 85 years old patients?
Hi, thank you for your question. And there is definitely an upper age limit for enrollment, and that's because patient safety is our main concern. So once a patient is above 85 years of age, that might make them more susceptible to a bit of more side effects. and more of systemic effects. So if you're looking for a trial in particular for a particular symptom, like whether it's a motor symptom for your motor fluctuations or maybe for other non-motor symptoms like any memory problems, mood disturbances, so it kind of varies from trial to trial because some of the symptoms are when you have Parkinson's for quite some time now, especially memory problems. So those are the kind of trials where the symptoms appear much later as you go on with the disease, might have a much higher age limit. So we literally have to look at the protocol and the age limit to be able to answer that, but definitely yes. There is an upper age limit, but whether it's 85, 87, that or 90, that varies protocol to protocol. And any other coordinators, if have comments, I can give it.
How would you find out about trials?
Okay, can I answer?
So the question is, how do you find out about these trials?
Okay, so I can, so we at Evergreen, we have a research website, which is the evergreenhealth.com, and it has the list of all our generic trials. And to make things simpler for you, because you have made all the effort to come here, we have a booth right here where we are giving out a concise pamphlet which has a list of all our currently enrolling studies. So, and it has the age limit on it too. Most of them do have an age limit, so we can provide you at the end of the session, it has a bag, the pamphlet, and the concise leaflet, which has the inclusion and the upper age limit. So we can go over it together and see if you might be interested in any one of them. Okay?
Thank you.
Great question. Thank you. Okay.
Thank you
Next
so
question.
much.
Yes, I was diagnosed with Parkinson's disease approximately 6 years ago, and I just wanted to know, I've been taking levodopa and that sort of thing. Does these drugs diminish over a period of years, and do they diminish down to just practically nothing after 10 or 15 years? Or do they keep going with it? Do they diminish, or do they keep going? Do you keep going with the drugs?
I missed the second part of the question. Are you saying the medications might not work so well if you've been off of medications for never been on medications? Is that correct?
Once you're on the trial, you're saying about the trial. Once the trial is over time, does the medication diminish? It's out of your system. Is that what you're asking? I guess how long? I guess it depends.
So I'm a little bit confused by the question, but is the question with time, can you reduce the amount of medication, or does it have less effect over time? Is that correct?
I think that's
Okay. Who would like to address that question?
I can address.
Sure. If you, yeah.
Oh, is it okay? Okay. So, so if I understand correctly, your question is like if you are on a trial, do you need to reduce your medications after the trial is over? Is it something like that, or is it? Yeah. After the trial? Okay.
So the question is, does the Parkinson's disease
Oh, I
medication...
understand the question now. After the trial, and the medication diminishes in the system, is it useless to you at that point?
Oh, I see. So the trial that provides medication.
Correct.
Correct. Okay. So the question is, the trial has a medication that's given. Does it lose effect after the trial is over? Is that correct? The question? No. Kind of.
You want
Yeah. Okay.
Deborah wants to.
Okay.
I think maybe I know where he's coming from. When I was done with my trial, I had to go off of the product until the FDA approved it. So that was hard on me because it was such a wonderful product. And so it was actually approved in 6 months, which is really unheard of. But then it was made available in another 6 months. So I was very happy to be back on it because my coordination was really off without it. And it doesn't stay in your system. It's a temporary fix, but if I didn't have all my meds, I wouldn't be walking or even out of bed. So I thank God every day that I have what's available to me. And it doesn't take any of the other meds that you take. It doesn't take any of that function away. So that's going to stay the same. And when my doctor says, try this, I do it, you know, because I trust her. Thanks.
We have time for 2 more questions. Okay.
Speak right into it. I will. My question is for Krista. Would you address a little bit the brain donation after we all die?
Yeah, and I'll have Skip say a few words about that as well. So we do have a brain donation program at our research site, and that's for participants who are enrolled in our studies. So like the Pacific Northwest Udall Center that looks at clinical changes in Parkinson's disease over the years and looking at memory and thinking changes. So we collect a lot of clinical data about participants over the time that they're enrolled, as well as genetic data. And then kind of the last piece of the puzzle is getting the brain autopsy. And so we do enroll participants who are interested in brain donation and that are in our studies. And I coordinate that program with some of our other coordinators. And Skip has talked about being enrolled before, so I'll let him say a few words about that.
Yes, if you look in my wallet, there's a yellow card that's visible, which says, in event of death, give this immediately to University of Washington, give the specimen.
Great question. Okay, the last. Oh, great. Okay, great.
So William, participant on the overflow room A, asked if there's a way for him to sign up for studies that only interested him, like the alpha-synuclein studies, because he doesn't want to be getting a bunch of emails from other studies he's not interested in.
So the question is, can I sign up for one specific study and not get any other mailings for other studies?
Yeah, you don't want the junk
Good
mail.
question.
Yeah, actually, if there's a particular site near you that you're interested in, maybe connected with your neurologist or something in your area or in the state, usually they have those trials that you're looking for listed on their website. However, if you ever go on clinicaltrials.gov and you're looking for a specific trial, on there they'll have the list of locations of all of their trial sites and who to contact. So you can always, if you're looking for a very specific trial, again, also go through your neurologist or through their website as well.
Great. No more? One more? No, 0?
I think we have one more question here.
One more question. Last person.
I'm really interested in the cause of Parkinson's. The cause of Parkinson's versus treating symptoms and finding cures. And I have an interest in if you could give me an estimate of how much percentage-wise research is being done in terms of the cause. When you're talking about finding cures, our environment and the inputs that affect our lives is undergoing constant change. So without understanding basic causal actions that produce Parkinson's, it might be difficult to deal with changes in future time that might affect the process.
Great question as well. So the question is, are there any studies that look towards understanding the causes that lead to Parkinson's disease versus the treatment for Parkinson's disease? Anyone want to comment on if there are studies that look at causes more of Parkinson's disease?
So I can have Bob speak to his experience here, but the trial that he's in, the interventional trial, is not for symptom control, but really looking at the theory behind what might be the causes of PD. So that's the trial that he's been involved in for the last 2 phases. And maybe he can speak to why he decided that.
The thing I liked about the Biogen trial was that the alpha-synuclein, which I don't know if somebody will be addressing that today, the buildup of that, and the medication being tested was to break that up, dissolve it, and thus stop the progression of the Parkinson's so that it wouldn't keep spreading to the other neurons in the brain. And that sounded intriguing to me. And so that's why I chose that one. And like I said, at this point, I have not noticed that there's been any progression in the 2.5 years. Of course, you don't know whether you're on the placebo or not either. And so it's just something that maybe in time we'll find out. But at this point, I'm happy with what we've done.
And also, there's a research panel with some of the investigators here this afternoon that can answer a lot of those questions as well.
Okay, great. So that will be the end of this part of the symposium. I'm sure if you have further questions, you can ask the coordinators who will be out in the resource fair area. And I'm sure the patients, oh, Deborah wants to say something. Great.
Hi. Well, I just want to give you my background, and I have my own opinion. I had a beauty salon for 20 years, and I did acrylic nails, and you all know it's pretty strong odors in there. There was 10 of us working, so I'll just leave it at that.
So with regards to further questions for the patients, would you be okay if someone approached you later in the resource fair if you had any more questions?
Can I comment
Yes.
on the genetic one? Because
Yeah, sure.
one more important resource would be the Michael J. Fox Foundation website. And there is actually a gene called the LRKK2 gene, which maybe, because let's see, Parkinson's as a disease, only a very, very minute percentage has a genetic predisposition. And most of it is like idiopathic. And even symptom-wise, it's not like one symptom. So it's tremor, it's the non-motor symptoms of constipation, mood changes, hot flushes. So it's a phenomena, as we call it. So it can be a little bit of genetic, but mostly it's environmental factors. So it's a lot of factors which actually may cause the disease. So if you visit the Michael J. Fox Foundation website, there are studies, because his question was specifically if there are genetic studies going on. So there are studies on the LRKK2 mutations, which you might look up. And adding to what we have already known, there is a study which is trying to kind of delay the progression of the disease, because alpha-synuclein protein is again one of the proteins which can be one of the causality for the disease. And we have an antibody which can actually work against this alpha-synuclein and neutralize the alpha-synuclein and help excrete it out of the body. So we at Evergreen is also having the same study. So it's not a genetic study, but it's a study which is something which is claiming to halt the progression. So at a very, very early stage, so the disease cannot be stopped, it cannot be reversed. The only thing this company is trying to do is to kind of slow the progression and see how it goes. So if you want to know more about it, we again have a booth and we can always connect after the session. All right? Thank you so much.
Okay, great. Thank you so much. More questions, just ask them. They'll be in the resource foyer. Okay, bye.
Thank you, everybody. I apologize for speaking as they're stepping off the stage, but we want to stay as close to schedule as possible. We have just a couple of announcements. I also wanted to address quickly just some of the questions that I was listening to. I myself do not have Parkinson's. I am what is considered a control, and I have been in 2 or 3 different studies myself. So I think generally what we want you all to hear throughout the day from all of us is that there are studies going on all the time on a range of different aspects of Parkinson's. Some things are familial. For example, my husband has Parkinson's, and many years after he was diagnosed at age 33, his mother was diagnosed after him. So they were particularly interested in his family. In order to get information about his family and genetics and DNA, they thereby have to test it against those of us who do not have it in our families. So even if you're a care partner or an interested friend or relative, there are lots and lots of opportunities to get involved, and sometimes it's as simple as giving blood, saliva into a test tube. Who's done 23andMe or, right? We've done that to find out what our heritage is. Come to find out we can do simple things like that to help contribute to this community who needs access to this information. So again, I just want to say the Washington State Parkinson's Disease Registry is a place where you can give your name, address, phone information, and when a researcher or clinician is looking for folks at a variety of ages, regardless of age or sex or familial relation, whether you have Parkinson's or not, they're looking for people all the time. I had someone reach out to me recently, and they were specifically doing a test on how well you hear or do not hear as a caregiver with your Parkinson's, person living with Parkinson's having trouble speaking to you. So as a control, I was providing information on what it's like as a care partner and the struggles with language. So again, there's a full gamut of opportunities, and if you're interested, please do sign up. I heard someone ask about getting information on one test might make you get calls for others. And my instinct is that we all get too much junk mail, and if you throw it away, just think of those extra solicitations as reminders that someone's fighting for the cure. That's one way to think about it.